Hello, my name's Dr. Hermina Nedelescu, and I'm a neuroscientist. Today, I'd like to speak to you about four major behavioral theories that I believe are important when considering therapist abuse, or really any type of predatory and abusive behavior. So, according to this theory, the experience of a positive hedonic state results in a transient opposing negative state until equilibrium or homeostasis is restored. So I'll say that again. The experience of a positive hedonic state results in a transient opposing negative hedonic state until equilibrium or homeostasis is restored. And this theory of motivation can be used to explain many different motivations, including alcohol use disorder, uh, opioid disorder, sugar addiction, skydiving, sexual activity, gambling. It can be utilized to explain much of how human beings respond. And there's this opposite effect. So there's an equilibrium, but when we are presented with a positive stimulus or a rewarding stimulus, we feel good. And then when that stimulus is gone, we drop below the equilibrium, and then it takes some time to get back to that equilibrium. So it's this opponent process theory of motivation because of the opposite peaks. So how does this apply to abuse? It's actually been presented in the context of abuse in a book called The Betrayal Bond. That is based on this theory by Richard Solomon from the 1970s. And the best way I can perhaps explain it is once more with the example of heroin. So when an individual takes heroin, they immediately feel euphoric. And when that heroin is metabolized and gone out of the body, then the person falls into a withdrawal state. And that is a negative hedonic state at that point, that withdrawal. And the learning that takes place to remove that withdrawal is a powerful, powerful factor to engage with this substance again. So, so how does the opponent process theory of motivation apply to abusive behaviors? Well, we can look at the opponent process theory of motivation from the viewpoint of the predator, but also from the viewpoint of the victim. So let's consider the predator first. The predator identifies a victim that makes them feel good, and engages with that reward. When the victim is gone, well, they are lonely, they fall into that negative hedonic state, and they search for the victim again. And so, with multiple stimulations, just like with taking heroin many times, that first peak actually gets closer to equilibrium, and now the individual needs that reward just to function normally. And then when that reward is gone, after multiple stimulations engaging with the reward, the withdrawal is even, the negative hedonic peak is even larger, and it takes longer to go back to equilibrium. So that's from the viewpoint of the predator. For the victim, perhaps the victim may feel special to be noticed by or given attention by a therapist who gives, extra attention to them as a patient. Works in the same way with clergy who doesn't want to be noticed by their pastor. So there's that initial positive hedonic state that a victim can get, can experience. And then when that's gone, well, you know, like all human beings, it takes some time to go back to equilibrium. With repeated, and of course the predator knows what they're doing, so often you hear the name love bombing, and that's exactly what happens. There's a predator who's giving continuous positive rewards and stimuli in the beginning, kind of setting the stage for that new interaction with the targeted victim. And then when the victim, when they stop, that the victim falls into this negative hedonic space, and then it takes some time to get back to equilibrium. And this is where a predator can, after this love bombing phase, can essentially begin to start punishing the victim or giving them silent treatment, and essentially putting them in a negative hedonic state. That's the important point. It might be very subtle punishment, might not seem like punishment, but essentially it's putting the victim in a negative hedonic state. And as I said earlier, removal of that agony in that negative hedonic state is a powerful factor for staying engaged in this in this cycle of abuse.